In today's video, we'll explore two high-yield clinical scenarios that test your understanding of drug contraindications and foodborne infections. You'll learn how to identify the causative organisms in acute gastroenteritis and understand why certain medications must be discontinued in peptic ulcer disease. These concepts are crucial for both exam preparation and safe clinical practice. A 27-year-old woman presents to the urgent care clinic with sudden onset of abdominal cramping, nausea, repeated vomiting, and watery diarrhea that began about 6 hours after eating reheated fried rice at a friend's house. She was previously healthy and denies recent travel, fever, or sick contacts. Vital signs show temperature of 37.2 degrees Celsius, a blood pressure of 100 over 64, a heart rate of 108, and a respiratory rate of 14. She appears tired with dry oral mucosa. Abdominal exam reveals mild diffuse tenderness without rebound or guarding. Laboratory studies are pending. Which of the following organisms is the most likely cause of her illness? Option A, aflatoxin. Option B, Bacillus cereus. Option C, Escherichia coli. Option D, Salmonella enteriditis. Option E, Vibrio vulnificus. The correct option here is B, Bacillus cereus, and that is because Bacillus cereus is a classic cause of food poisoning, especially after eating reheated starchy foods such as rice and pasta. And this is because this aerobic spore-forming bacterium produces preformed toxins which cause both vomiting and diarrhea, and these symptoms generally last 12 to 24 hours. Let's have a look at why the other options are incorrect. Option A is incorrect because aflatoxin is a potent liver toxin found in rancid nuts. It is not found in fried rice and does not cause acute gastroenteritis. Option C is Escherichia coli is incorrect because infection with this causes nausea, vomiting, and bloody diarrhea and may progress to hemolytic uremic syndrome, especially in children and elderly. It is acquired from undercooked meat, contaminated produce, or unpasteurized products. Option D, Salmonella enteriditis, is commonly linked to contaminated foods such as raw or undercooked chicken, eggs, mayonnaise, ice cream, and other dairy products. It may also be transmitted by pets such as turtles. The symptoms would include nausea, vomiting, and abdominal pain, and because Salmonella is also an entero-invasive organism, it may cause bloody diarrhea. Option E is incorrect because Vibrio vulnificus is a pathogen that is found in shellfish. Patients with liver failure and hemochromatosis are especially susceptible to this infection, and this pathogen is not found in fried rice. A 55-year-old woman presents to her primary care clinic with a 1-week history of worsening upper abdominal pain and occasional dark vomit. She has a history of high cholesterol and hypertension. Her medications include rosuvastatin, enalapril, propranolol, niacin, and omeprazole. An upper endoscopy reveals a large gastric ulcer, and biopsy confirms infection with Helicobacter pylori. She is started on eradication therapy. Which of the following medications should be discontinued in this patient? Option A, rosuvastatin. Option B, enalapril. Option C, propranolol. Option D, niacin. Option E, omeprazole. The correct option here would be D, and that is because niacin is a lipid-lowering agent that increases HDL and decreases LDL, VLDL, and triglyceride. However, it stimulates histamine release and increases gastric acid secretion and aggravates peptic ulcer disease. Therefore, niacin should be discontinued in patients with active ulcers. Let's have a look at why the other options are incorrect. Option A is incorrect because rosuvastatin is an HMG coenzyme A reductase inhibitor used to lower cholesterol and triglyceride levels. It is safe for use in patients with peptic ulcer disease and does not interfere with ulcer healing or H. pylori eradication therapy. Option B, enalapril, is an ACE inhibitor and is commonly prescribed for hypertension and heart failure. Side effects include cough, hyperkalemia, and in rare cases, intestinal angioedema, but it is not known to worsen peptic ulcer disease or interfere with its treatment. And option C, propranolol, is a non-selective beta blocker used for cardiovascular conditions such as hypertension and arrhythmias. Beta blockers may even reduce the risk of gastrointestinal bleeding, and they're not contraindicated in peptic ulcer disease. And option E, omeprazole, is incorrect because omeprazole is a proton pump inhibitor that suppresses gastric acid secretion by inhibiting the hydrogen potassium ATPase pump in gastric parietal cells. It promotes ulcer healing and is an essential part of H. pylori eradication therapy.